again into our usual program on the educative activities podcast. Today we are going to be talking about upper GIT bleeding, and again our guest on this program is Dr. Kimonia. Good morning and welcome.
Thank you. Good morning.
So, can you kindly tell us what is upper GIT bleeding and why should we know about it?
All right. So, upper GIT bleeding, simply, first of all, GI, like we know, is the whole system from the mouth, the esophagus, the stomach, and then the intestines up to the anus. That's the whole GI, right? Now, bleeding, we already know what bleeding is. Now, upper GI bleeding means that you have some sort of bleeding in the upper part of your whole digestive system. So usually it involves any bleeding from the esophagus, the stomach, and the upper part of the intestine. And it's a concern, and we're talking about it because usually there are some things that can cause you to have like some kind of mild bleeding from the upper GI, but then there are other things that can cause massive bleeding from the upper GI. And when there's massive bleeding, you can vomit blood, and you can have some blood in your stool as well. And it's a major concern because it's an emergency. You can prevent it, and it can rapidly lead to death. That's why we're talking about it.
Yeah, that is so important, and particularly in our communities, because from what I understand, when you have such kind of an emergency in a hospital and maybe finally the patient dies, in the community, what they always say in our own context is that the person was poisoned. Any upper GIT bleeding that's leading to those kind of presentations, like somebody's vomiting blood and things like that, and finally dies. In our communities, it's always said that the person has been poisoned. So I think it's so important for our people to know what upper GIT bleeding is all about, and you have really made it simple for everyone to understand. So, what causes upper GIT bleeding?
Yeah, thank you so much for that question. So, in today we're really talking about the kind of bleeding that is massive, right? That leads to vomiting blood, and there are two major causes, and then there are other causes. So first of all, remember, the bleeding we are talking about here is you actually vomiting blood. We're not talking about the kind of bleeding where you can vomit, you can have normal vomiting, and then at the end of it you see a little bit of blood. That's not really a problem, because it's expected that because of vomiting you've kind of like caused some wounds at the level of the esophagus, so the wound can produce a little bit of blood. So in this case, we're talking about that kind of much bleeding such that it has triggered and caused you to vomit out the blood. And the number one cause of it is bleeding from a peptic ulcer. So most of us know what ulcer is. Sometimes we call it gastric, and people take it very lightly. Someone is complaining about pain in the upper chest, in the upper abdomen, like down here. And when you want to probe further, they'll be like, nah, it's just gastric, I've had it for a long time. But it's not just gastric, because if you don't treat it, that ulcer, which is what we call in quotes gastric, that ulcer can because it's an ulcer, it's like a wound, and the stomach and the upper part of the gastrointestinal system is a thin wall. So if you don't treat that ulcer, the ulcer will become deeper and deeper, and if it touches a blood vessel, it's easy to bleed out. And because the GI is an open space, like inside there's a lot of space. Unlike having a wound in here, the bleeding will be controlled because there's not much space to contain blood, but inside there's a lot of space, so you will just keep bleeding out, and then very soon you start vomiting blood. So the number one is ulcer, untreated ulcers. And then the second cause is what we call esophageal varices. Yeah, so that's a bit complicated, but it's important for us to know because it's secondary to, or it's a complication of liver cirrhosis. Liver cirrhosis is one of the liver diseases, right? Yeah, so esophageal varices is more of like when your liver has become hard or has become destroyed due to several factors that we'll talk about. And then the blood vessels before the liver begin to, like, you know, stretch out. And when they are stretching out, there's not enough, you know, it's just like a weak pipe. And if it keeps stretching out, it can easily burst, and it's very dangerous. You vomit blood, and when you lose blood that way, it can quickly lead to death.
Yeah, really, absolutely, very, very important points there. And I remember always, even yesterday, I was talking with somebody, and she was just telling me, oh, I have some kind of gastric, and it has been for long, it's just a urea kind of thing, and now it's really making me feel bad. I need to do more detailed exams. So it is very, very important. People do not need to neglect the things that the feelings of pains.
Exactly.
Saying, okay, gastric is a routine, a normal problem that everybody may have. No.
Exactly, no.
As you have just explained, it is something you need to take care of, because it can lead to much more further complications like the upper GIT bleeding and so on and so forth. And of course, we have to take care of our livers. And really, I think it is going to be very, very necessary for you to tell us more about really how we can take care of our livers, how we can take care of as we call it, gastritis, so that this kind of situation of upper GIT bleeding that may rush us to the emergency department do not happen. So
first of all, we'll go back to ulcers, right? We already spoke about the fact that the first thing is that if you're feeling any kind of pain, it's good to go to the hospital and consult. But the thing with ulcer or gastric in quotes is that people think it's so common, and everybody feels like they can manage it on their own. But gastric is not really like that. It's not only about taking some water and feeling some relief and thinking that, you know, that's it. It's good to get tested, because one of the major causes of peptic ulcer disease is H. pylori infection. That's why if you go to the hospital, they'll ask you to do certain tests. You know, it can feel like, I don't want to go through all of that, but it's important to actually seek care, do the tests that you need to do, and follow the treatment. Because if we don't eradicate the H. pylori by giving you triple therapy for a period of time, 10 to 14 days, you're not going to, you know, the ulcer is not going to get treated. And then there are other things that can trigger ulcer formation, or even worsen a small ulcer that you may have. For example, alcohol consumption, other things like self-medication. You know, oftentimes we self-medicate with lots of drugs. For example, somebody can just have a fever and they'll go to a pharmacy and get Coartem, antibiotics, ibuprofen, Paracet, and according to them, they just want to ensure that they are able to treat everything that could potentially be causing the fever. But taking too many drugs like that can lead you to developing an ulcer, or can worsen a small ulcer that you have. Stress can also worsen ulcers and, you know, lead to bleeding. So when it comes to the other causes of vomiting blood, which is like I spoke about, the fact that the vessels in the esophagus become big and they can burst, is usually due to secondary to liver cirrhosis, like a liver disease. And most things that cause injury to the liver can lead to liver cirrhosis. So to prevent liver cirrhosis, hence preventing esophageal varices and preventing the vomiting of blood, we need to do certain things, like, again, avoid alcohol, because alcohol can cause liver disease. That's what we call alcoholic liver disease, which is simply liver disease due to consuming too much alcohol, right? And then we also have fatty liver disease. So people who are obese are at risk of developing liver disease, because the fat kind of like also plays certain role in the body and can change the way that our liver functions, and it can lead to liver disease. So if you're overweight, you need to work on your weight for several reasons, including the fact that you are preventing a liver disease. Then other things like, hepatitis, right? That's why we always talk about screening and taking vaccines. That's why you hear people talking about hepatitis B vaccination, because hepatitis B can lead to hepatitis B and C as well, but more commonly B, can lead to liver cirrhosis and then that kind of problem. And of course, preventing hepatitis B, we talk about things like practicing safe sex. So when we're talking about practicing safe sex, it's not only about, you know, preventing HIV or preventing pregnancies or preventing, there are also many other STIs that are really dangerous, like hepatitis B is a sexually transmitted disease, right? By preventing safe sex, you reduce the risk of contracting something like that. Yeah.
Thank you so much, and I think these points are really absolutely very important for our people to always remember, that even if you have what people commonly call gastric, you need a checkup in the hospital, and once you are diagnosed maybe with the cause of it, maybe with the bacteria that is causing it, your doctor is going to prescribe you a treatment, which after the treatment you should come for a rendezvous as the doctor has given you, because if you do not follow up these things, you are at risk. Don't just think that because you are able to buy some drugs that can calm down the situation, it is over, because tomorrow you may come back with a much more a bigger problem like the upper GIT bleeding. And buying drugs for yourself can even put you at more danger, as you have said. Like, you know, they just do a combination of everything, including antibiotics. I know it is quite a big topic that we could talk. And ibuprofen is really dangerous. So you need always to go to your doctor. It doesn't matter if you know what calms down these pains, but you need that your doctor confirms with you that this is a necessary drug to take for this condition. And besides, avoiding alcohol or reducing alcohol intake, that is not the only problem that can help you, that can make your liver to be sick. Also, fatty livers can also make you to be sick. So even for those who are taking things like sweet drinks, too much of everything can be a problem, and getting obese is a risk. So thank you so much for such kind of reminders, and that we have to be really cautious about this so that it can help us to prevent upper GIT bleeding that can take us to the emergency rooms, and of course we may even die if so this is also so important. And with this now, we may want to really know, when this happens finally, what do we do?
Okay, so in case this already happens and you have some bleeding, and what we mean by when this happens, remember today we're talking about vomiting blood, right? But people who are also bleeding from up there can also have dark blood in their stool. I don't want to talk about red blood in the stool because that's something else, but if you see dark soft blood in your stool, it's also coming from up, and then vomiting blood. So once you have that, it's an emergency. Like, don't play with it, because like I said, you could vomit a cup of blood, but in there could be a whole lot more, right? So it's an emergency. The first thing is that you need to rush to the hospital, because really there's not much that you can do about it. And when you rush to the hospital, because you're losing blood, and sometimes it can even present with like signs of reduced blood volume, like they could be weak, they could even faint and stuff like that. So in the hospital, we're going to first of all replenish the fluids. We'll give some fluids. We may need to give blood depending on how the patient is presenting, but all in all, it's an emergency and we need to act fast. So sometimes a doctor will prescribe some drugs that will help to suppress the acid in your stomach. So it's usually omeprazole or another kind of PPI, and in this case they'll want to inject it because, you know, you're vomiting blood, you may not be able to swallow, so they may inject you with that kind of medication and other kinds of medication that can help to reduce that acid and movement in the stomach, right? And then one of the major things that we also do, which is an emergency, is that if the bleeding doesn't stop after a short period of time, we'll send you to a facility where they'll send a tiny camera into your stomach and look for where the bleeding is coming from, and try to see and try to stop it. So they can put some medication in there through that tiny camera, and through whatever device they're using to get into your stomach to look for bleeding, which is called an upper GI endoscopy. So you may have heard about this, maybe if you had a family member or if you had vomiting of blood, this may have been prescribed for you. Or sometimes there are some people with ulcers that they are treating and it's not going away. So even before they present with vomiting blood, we send them to go and do this test where they put a camera to look for what could be causing that pain. You know, it's important if your doctor prescribes that investigation, don't be scared. You know, it may feel scary that they're putting a camera into your stomach, but then it's just so that we can prevent this kind of complication, right? So if you've been prescribed an upper GI endoscopy, try to get it done. And it may also be one of the ways that we'll use when you present with vomiting of blood to find out where the blood is coming from and possibly stop it as well. And the treatment doesn't end there, because remember, at this time we are just trying to stop the bleeding. We'll go ahead to actually look for what caused it. Is it ulcers? We'll treat it. We need to treat it and follow up, like you said. You'll come back after treatment and we'll check if we've successfully eradicated the H. pylori in case that was the cause. If it's from a liver problem, you need to do continuous follow-up, because there's actually treatment for most of these diseases, right? There's management for hepatitis B, hepatitis C. So yeah, just coming for your treatment and follow-up is very important.
Yeah, really, coming for your treatment and follow-up is absolutely very important, and that it's not just like when you are rushed to the hospital and you look stable, the problem is finished. It means the deeper the root causes of what is making you to get the upper GIT bleeding will be checked.
Exactly.
And of course, you are going to be treated and follow up for a long period of time to be sure that you are safe and to make sure that you prevent that from occurring again. So I think this is so important, and we are very grateful for these details about the management. And of course, many of our people now should understand that we are not saying that you cannot be poisoned, but you need to consult your doctor. So if you have an upper GI bleeding, don't only think about maybe some people are against you, some people are, you have to go to the hospital and they have to take care of you. Thank you so much for these details. Is there any other thing that you want our people to know about upper GIT bleeding?
Not really. I mean, we mostly spoke about the major causes, right? Which is really what we can try to prevent. There are other, rare causes of vomiting blood. Like if you have a cancer, you can vomit blood. Probably not a lot. If you have a gastritis, which could also due to taking too many pills and other things. And very rarely, some people could be coughing blood, right? The blood could be coming from their lungs, and instead of coughing the blood out, they're kind of like swallowing the blood, and then later on they vomit blood. But it will also more likely not be a lot. But like we've said, the most important part is understanding the main things that may cause you to vomit blood that can lead to death. But just wanted you to know that there are some other rare causes of mild vomiting of blood.
And remember, it's only your doctor, the healthcare providers, that can really be able to assess you further and be sure that this is what is causing the upper GIT bleeding. And as we have learned, it could be like you are vomiting blood, or it could be like the color of your stool. It changes, like she explained. So don't just expect that maybe if you are not vomiting much blood and then also the color of your stool has changed and it's looking like that dark kind of red. It means also that that can be from an upper GIT bleeding, so you need to consult your doctor. So it's so important. Again, thank you for these very important educative points, and we look forward to many more. And we will be inviting you again in our next episode to talk about other topics of interest to our people. Thank you for coming, and we wish all our audience good health.
Thank you.